Hello and welcome back to Sepsis Voices with Dr. Ron. That's me. I'm your host, Dr. Ron Daniels, and we're going to be talking about maternal sepsis today. At the time of recording, it is mid-May and it is Maternal Sepsis Month. So it's really important and timely that we raise attention to this important issue. And joining me today is Dr. Poppy Gibson, who is an academic and a mum, and she's going to join us to share her experience of maternal sepsis. And really, I think we need to be extremely grateful to Poppy because this is actually the first time she's talked about this openly in a forum like this. So we're going to be talking about various issues, including how recovery can be especially challenging for new mums and touching on some of the various support options and resources that are available to people who have had maternal sepsis. Anyway, enough of me. Welcome, Poppy. Do you want to take a few moments to introduce yourself and tell us about your work and your kids?
Thanks, Ron. Thanks. Hi, and hello, everybody listening. So, yes, my name is Poppy, and when I'm not teaching, I'm a mum of three, a busy mum of three, as those parents amongst the listeners will know. It doesn't end when you come home from work. That's when the real fun begins. But I love being a mum, and it just so happens that sepsis is a part of that parenthood journey for me. And like Ron says, I've never actually recorded my voice speaking about this. I'm really grateful. The UK Sepsis Trust shared my story on their Voices page recently, so you might want to have a read of that. But yeah, Ron, this is the first time I'm kind of chatting about it, so thanks for having me.
Not at all, and we'll be ever so gentle with you because this is going to be an emotional journey. But of course, the reason you're doing it is it's going to help others. So fantastic that you're doing this. I'm just going to take a few moments to explain what maternal sepsis is for some of our listeners to whom the term might be a new thing. Well, a reminder that sepsis is the way the body responds to infection. So it's always triggered by an infection, but in sepsis, the immune system goes into overdrive. And in maternal sepsis, this is, of course, sepsis that happens during pregnancy, during childbirth, or in the weeks and early months after childbirth, when we call it puerperal sepsis. It can also be a side effect of complications of pregnancy, including, very sadly, abortion, but also the need for examination by health professionals, instrumentation, up to and including caesarean section. So there are a number of reasons that pregnancy can bring about risk factors. And some of the warning signs are the signs of infection, so a temperature or a high fever, rapid heart rate, difficulty breathing, abdominal pain, vaginal bleeding or foul-smelling discharges, as well as, particularly after pregnancy, very painful, tender and engorged breasts, as well as general weakness or fatigue. So, Poppy, why don't we start with your story and how you first noticed something was wrong and when you first realized that it was something that needed hospital attention?
So I have to say now, hearing all those symptoms back, I think, oh my gosh, how did I not know about sepsis at the time? And I feel quite ignorant that I didn't know about sepsis. I didn't know about maternal sepsis, and so I think this is part of the problem. It wasn't something that anyone was asking, like, could it be sepsis? That didn't really come into conversation until, a couple of weeks later. But so really what happened, it was my second child. So, pregnancy was going well. And then it just so happened around week 34, I think it was. So getting towards the end of the pregnancy, looking forward to meeting my little one. And I just started feeling really unwell, and it was really hard to breathe. Like, my breath was really shallow. I felt like I couldn't breathe fully. I felt like I couldn't expand my lungs, and it felt like something was wrong on one side of my body, kind of like under my rib cage on my left side, like I couldn't breathe and something was wrong there. And the midwife said, why not go to A&E, get it checked out? So, and you feel awful, like, oh, I'm making a mountain out of a molehill. So, but I agreed, because I could tell something wasn't right. And I'd been pregnant before and, delivered my child. And this definitely felt a new, not just a normal pregnancy niggle, because I think particularly for new moms, the first time you're pregnant, you don't know what to expect. Like, everything's a surprise. But I'd already gone through one pregnancy, and I was like, this is a new pain. Like, this isn't something I've had before. So I did go to A&E. you know, after a wait there, I had the X-ray, and when they looked at the X-ray, they could see on the side where I was complaining of the pain was like a shadow. So on my lung, at the base of my lung, was like a shadow. And after kind of all the people looked at the X-ray and talked about it, they said, "Oh, we think just your lung has become compressed because, you know." And I had I can't remember what it's called, the condition where you have extra fluid in pregnancy. And
Yes.
so that thing. So my bump was huge. I'm really small, and so they just said, I think it's compression of your lung, and that's why you're finding it so hard to breathe, because you know that your lungs were kind of squidged. So I felt really awful that I had wasted everyone's time all day. So I went home, and completely unrelated, but kind of a blessing in disguise, was that I had the liver disorder, where they have to deliver your baby at 36 weeks. It's the one where you get really itchy. So some of you listening might know that one. I get really, really itchy. And so it just so happened they wanted to induce my baby. So the pregnancy was cut short anyway, and I was still struggling to breathe, and kind of felt a relief when they said, let's go ahead with the induction, whereas normally that might be a bit scary. I just felt like, okay, I'm just ready to deliver this baby and hopefully, you know, feel better again. They delivered the baby, and I had, you know, I was induced and gave birth naturally to the baby. But things like didn't start to improve then. If anything, I was feeling worse. And obviously, anyone listening that's given birth knows your body does feel awful after you give birth, like nothing you can imagine. But it wasn't even anything to do with any of the birth pain. It was still this pain in my side that seemed to be getting worse. It hurt to sit up, it hurt to sit down, it hurt to pick my baby up. But luckily we went home. You know, the baby was fine, which was the main thing. And I think when you're a mum or a parent, like the baby is suddenly the main thing, it's the main concern. So I was like, the baby's fine, do you know what, I'll be fine. So I went home, back to my other little sibling that enjoyed having this new baby in the family, and everything was going fine. And then just, you know, I just kept deteriorating. I felt like a husk. I don't know what other way I can say. I felt like some kind of like zombie mum or something. I felt really sweaty. I didn't have an appetite. It just hurt to move. So I didn't really want to do anything. But obviously I'm like, I've got this baby, I have to engage with motherhood. So kind of just got on with it, you know, enjoyed taking photos of my baby and sharing them, and everyone's asking, how's the baby? Everyone's forgotten about the fact that I wasn't well, you know, and I'm trying to forget about that as well. And then it just came this critical point, 9 days later, that I just remember it so clearly as well. I was sat in bed, I'd managed to breastfeed my baby and pop him back in the Moses basket. I was in so much pain. My husband came upstairs and I just went, oh my gosh, put the heating on. It is absolutely freezing. And I'm sat there, like I've said in your Voices story on your website, I was sat in flannel pajamas, like woolly socks, my dressing gown, like my duvet, like I was like a little like huddled babushka in all my robes. And my husband was like, it's not even cold. I was like, please put the heating on. And he was like, something's not right. Why are you so cold? And then literally as he kind of questioned me, I just started shaking. It was the oddest thing. Like my whole body was just like shivering, so shivery that, and I couldn't control it. And he was like, something's not right here. So he rang 111 and explained the symptoms. And they had thought it was pneumonia, that the lung compression that hadn't cleared up. I missed this vital part of the story. I had been taking pneumonia medication for a couple of weeks and administering something called Clexane, which is I think a blood thinner. Is it a blood thinner?
It is, yeah.
Oh, good. I learned some, you know, when you have sepsis, you'll learn some medical stuff in the meantime. So I remember administering the Clexane as well, and like an EpiPen type thing. And that was another thing that now looking back was really weird. I was having to inject this kind of EpiPen type thing into my thigh. And in the last few times I was injecting it before this critical point with the shivery incident, I kept thinking that it was like an ink, almost like a tattoo ink going into my leg. And I kept thinking as the Clexane was going into my leg, it was leaving like black tree roots in my leg. Now that sounds really odd to say that. But I delivered my Clexane just before I was shivering, and I'd been having these weird thoughts about it. But you know, you're exhausted as a new mum, so you just think I'm going a bit crazy. And yeah, to cut a long story short, 111 said come back in. so we went into the hospital, sat around in A&E for a day, couldn't give a urine sample, so I felt like a failure. They were like, please fill this sample bottle, and I couldn't, and I now know that, like you say, Ron, is a symptom of sepsis. But still no one had said sepsis at this point, so I'm kind of 9 days post-birth, and obviously this has been going on for a couple of weeks, and finally this amazing doctor came out, and he just said, I think the pneumonia is a red herring, and he ordered an MRI scan, and it was only at that point that they found that literally my whole body, and it was the most disgusting thing I ever heard in my life, was filled with pus from a kidney abscess on that left side, where I'd originally thought something was wrong and they thought the lung was compressed. Turns out the lung was compressed and the shadow was all there because of this kidney abscess that had been unspotted for potentially a week, 2 weeks, I don't know how long, and my whole body was filled with pus. They ordered straight away, get a drain, which is again the most disgusting thing you can go through. Just when you think giving birth isn't, that's definitely a low point for a woman's body, like there was worse. There was this bag with like a vacuum cleaner thing attached to my side, and and that was it. And into intensive care then that night, and that was kind of when they said it's sepsis.
Wow, that's I mean, that's such an incredible story, and obviously it's a frightening story, particularly if any listeners are pregnant now. And we're going to come on to sort of some general guidance on how common this is, and how it's important people are aware but don't live in constant fear of this. So of course we'll come on to that. Um, uh, had you heard of sepsis before this happened?
I have to admit, no, but I had heard the word septic, so I knew, like, don't let something get infected and become septic. So I kind of heard that, as a child in the garden when you cut your leg on an old nail or something. So I kind of knew that. And then I must admit, when I still had my faculties at that MRI scan, they said it's sepsis, and I Googled it and it came up saying like originally known as blood poisoning, and I was just like, oh my days. But yeah, that was pretty much when I first started to learn about it, literally at that time.
Yeah, no, that's it's so common that people have sort of vaguely heard this word. I think so many people associate sepsis with a dirty cut, but of course, that's fewer than 10% of cases of sepsis, and far more common are pneumonias and urinary infections and things. But I really want to highlight a learning point for any health professionals listening from your story, which was, please listen to the patient or their families if the patient can't communicate, because you said from the very outset something was going down the left hand side of your body, that you felt the left side of your body was breaking down, and lo and behold, that's exactly where the problem was. So we health professionals, we like to look at x-rays and CT scans, and we see the thing we hone in on. But if it doesn't fit with the story, look for something else. And I really want to hammer home that learning point for health professionals. So you said that this was your second child, and obviously you'd been through a pregnancy before, you'd been through childbirth before, and you knew what normal felt like, if it can be described as normal. But and something felt very different. Now, for first time parents, they might not know they won't know what normal feels like in terms of pregnancy. They can seek advice from other people in the family who've been through this, but they won't have direct first-hand experience, and they might not be able to assert themselves. They might think they're going to be a nuisance. So what would you say to, you, if this was your first pregnancy and you were going through what you were going through, or another first-time mum who was developing symptoms like these?
Good question. So, do you know what I think I'd say? I guess if you think of it like a cold, like we all get colds all the time, don't we? And when you have a cold, you feel unwell and you have those moments where you're like, oh, I'm so poorly. But in the back of your mind that you're going to get better, and you're just, being a bit dramatic. But the way this felt differently for me, despite all the other pregnancy, delights and aches and pains, and the swollen ankles and and everything, this to me just kept getting worse. So whereas like other symptoms come and go, this was very like constant. So I think if you're experiencing that a pain, and really a pain, I think that's the main thing as well, not just like a niggle, it really was a pain to the point where I mean, on that kind of 9th day after I gave birth, the day we went in for the MRI scan, I actually started to think, I don't think I can live with this pain anymore. And I have a very high pain threshold. And for anyone listening who's, given birth, you do too. Like, you've survived something really super painful, but this felt worse than anything, like anything I've ever had, to, like I say, to the point that I was sitting there thinking, I literally can't keep doing this anymore. And so I think if you're starting to feel that something is that bad, clearly something isn't right.
Yeah, absolutely. So it's kind of trusting your instincts, isn't it? Although you've not had an infection in pregnancy before, if you're a first time mum, you've had infections before, and it's just trusting your instinct. This doesn't feel right.
Definitely trusting your instinct, and then definitely speaking out as well. So, like I say, speaking to the midwife, speaking to people in my family, and then finally thinking, do you know what, I can't put up with this anymore. It is time to call 111 or time to go to the hospital. And it's hard because the baby is your world at that point, but you need to think, how are you going to be a healthy parent if you're not well in yourself? So you also need to put yourself first at that point as well, I think. And I think that's what was so hard for me, because I was so caught up in being a new mum. You need to actually think, are you being is that the best situation for your baby, to have someone who's not 100% around them?
Yeah, absolutely. And I promised that we'd sort of talk about the numbers, and we're not going to go into a sort of incredible detail. And I think we have to be very grateful and conscious and acknowledge that we are in a high income country with a very mature and effective health service, and the majority of our population having quite reasonable access to those healthcare services. The situation in low to middle income countries is, of course, very different. And maternal sepsis in countries like those is a very, very real and immediate threat. But for balance, I think we should just talk about here in the UK and in high income countries like the UK. This is pretty uncommon. And the vast majority of women who develop sepsis during or after pregnancy go on to survive. We're going to talk about what survival is like a bit later on. Sepsis as a cause of death in pregnant women in the UK, it's between about 1 case and about 3 cases each year. So it's not a common thing, obviously. If it's 3 deaths, that is 3 deaths too many, but that is among around 700,000 people who deliver babies safely each year. So I think it really is important that we reassure anyone listening the context here, that what happened to you is not a common occurrence. But do we need to tell mums to be about this in antenatal classes and through other avenues? We tell them about what to expect from a normal pregnancy. We tell them about advice around childbirth and pain relief. But do we need to teach them also about some of the common conditions that they might want to look out for?
So I think obviously UTIs are something that you're going to have more probably when you're pregnant. So I think as a mum, or an expectant mum, you do want to know what is coming up. Like, it's better, what's the thing, better the devil you know, or whatever. So I think in a way, if I had known, if you start, something starts feeling really painful, could it be sepsis? Could, something which, again, they never really pinpointed what started the maternal sepsis for me, but I wonder whether it was something from connected to a UTI, because obviously it was my kidney, so it's connected to the waterworks somewhere.
Yes, yeah.
You know more than that than me, Ron. But I think, and I also just wanted to praise you as well, and UK Sepsis Trust, because I know there's been a lot of stuff in the news about the great story you've done on Coronation Street, our famous English TV show. And I think it just shows how putting something so simple as a storyline in a popular show helps raise awareness. So I think even if not everyone attends classes, let's be realistic as well. I don't think certainly with my first pregnancy I went to every single one, and then the second pregnancy comes, and for any parents listening, you've had more than one child, you may have been the same as me, you kind of feel like more confident. You don't need to go to every antenatal class. So I think thinking of those other creative ways, like you've done through helping support Coronation Street with their storyline, is another great way just to raise awareness in a more kind of gentle way as well.
Okay, so that's really helpful. And so what you're saying really, it's about a multimodal approach. We use any devices and resources that we can get hold of to remind the general population around the risks of sepsis. And I suppose it's our job to sort of hammer home the point that this is not only a condition that affects very old people or very frail neonates. This is something that can affect anyone at any age.
Now, exactly. Yeah, I was in my late 20s, so again, you would not expect someone in their late 20s to be in intensive care, you know, on death's door because of an infection. And like you say as well, Ron, like we think of sepsis with like a rusty cut, but there was no external cut on my body. So
absolutely. And that's why we were really pleased that Coronation Street wanted the story to affect the character called Ryan Connor, who's in his 20s in the programme. You know, it really hammers home the point that this is something that can affect anybody at any age. So just coming back to your story, Poppy, and you know that doctor who sort of described the pneumonia as a red herring and found the kidney abscess, you know, that set of actions probably saved your life. And you know, it was still not an easy ride. You described that you ended up in intensive care, where I understand, or you told me when we met in a train station, that you witnessed a death and you experienced odd feelings or odd memories or odd visions and almost became paranoid at times. What would you want people to know about experience in intensive care? And you know, obviously, let's hope no listeners end up in intensive care. But how would you describe you navigating through the intensive care stay and the immediate period thereafter, the bits of it you can remember?
Well, I mean, obviously, for most people listening, hopefully, yeah, you haven't visited an intensive care unit, or if you have, you know, it was maybe to see someone else who was very ill. So already it's probably got negative connotations. I think the only time I had seen kind of intensive care type settings were on films, you know, where someone's at death's door on a film. So already for me, when they said we need to admit you to intensive care, that felt very scary. But the main thing I would say is just keep calm. Like the fact that you're there with the experts who are going to do their best for you just have to trust in them. And honestly, I'm so grateful, obviously, from that doctor, like you say, Ron, who said it was a red herring. And now that's my favorite phrase that I use always through life. Like, because I think you're right. And there's another fishy related thing I'll briefly tell you as well. So he said, I think it's a red herring. And when they did the MRI scan, then I went onto a small ward while they kind of investigated, and my blood pressure was super low, my temperature was super high, and I kept having the shaky thing. And they said, why don't you order some lunch? Like, we don't know what's wrong. You might be here a while. And I ordered the smoked haddock. And I just remember as they wheeled my lunch in, I'd begged someone to open the window because I kept saying now it was really hot at this point. They wheeled in this smoked haddock, like filled the ward with this really horrible smell. And then I started the proper shakes, and like everyone was like running over. My bed was surrounded by staff, and to this day now I cannot have smoked fish. So also I would say for anyone who does go into hospital, don't order the smoked fish. But I would say, yeah, just trust the experts, because I felt so scared that, you know, I was like, what is sepsis? And like I said, I quickly Googled it, found out it was blood poisoning, which sounded really scary. And now I know we don't use that term, but that was what I'd seen in black and white. I was like, oh my gosh, like anything to do with poison cannot be a good outcome for me. And I've seen enough Disney films to know that that is not a good scenario. And again, I think that's another thing that I wish I'd done more at the time, was maybe to talk about my experience afterwards. So intensive care does seem really scary because lots of really foreign noises. You're going to see people probably as poorly, if not more poorly than you. And yeah, the one thing you mentioned there, Ron, the old man opposite. So I was kind of sat up in bed. No, I couldn't really do anything apart from watch this old man in the bed opposite get weaker and weaker until he died. And watching someone die is really horrible when you're powerless to do anything. And then, seeing the doctor kind of fill in the notes, and then the doctor came and sat next to my bed next. I was like, oh man, like, no, I'm on the conveyor belt to death. And when you're in that situation, I wasn't able to talk at that point. I was very ill and very weak and kind of attached to everything. So all you have is your thoughts and what you can see, and what you can see is scary, and what you're thinking about is scary. So I guess at that time you just have to be patient and rest. But when you come out, and I think this is something we'll probably talk a bit more about, Ron, isn't it? But yeah, just talk about it, because it is a massive thing that's happened. And I mean, I'm really grateful now that, Ron, we're talking about it you're finally helping me 8 years later to talk. But man, like, do I wish that I'd done that 8 years ago? And I think that would have helped me kind of, maybe not closure, and I don't know for anyone that ever has sepsis, I don't know if you'll ever get closure on it, if I'm totally honest, but I think it would have helped me heal quicker if I had. So I would just say nothing can probably prepare you for intensive care, but just talk about it when you come out. And I'm sure people will listen, whatever, whoever and whatever you can find to listen, just talk about it, and it will normalize it for you.
Yeah, and I think we are generally, as a profession, we're not good at describing to people who've been through such a serious illness in intensive care what life's going to be like when they get home. And often people leave and they've had these paranoid feelings, and they've had hallucinations, and their brain's all over the place, but no one said that's normal. That will get better. And it's just so important that we reassure people that that will happen. But how about the other people in the immediate family? Because obviously, your husband was there, and
Hmm.
and then he had your son and had to look after him almost as a single dad
Hmm.
for a while. And that must have been, obviously an awful time for you, but quite a strange time for them. And your husband might at times have not even known that you were going to come home. What have you managed? I'm sure you have, but have you two talked about it, and how it was? And I suppose also, how did it affect bonding with your newborn son?
Yeah, so many good questions. And I think that's a sign as well when you know something is wrong, because so as soon as I went into intensive care, I wasn't even really thinking about my family. That sounds really awful, but you're just kind of waiting to die, or waiting to see if you live. You're not sure, you know. They're doing all they can. I had to have blood transfusions. I remember one really funny thing, not funny, but I had to have blood transfusion because I think this is what they said to me, because I'd obviously been like blasted with antibiotics. Something like my blood was diluted. I don't know if
Yeah.
that's okay. I remembered
But
correctly.
yeah, it'd be more if they've given you lots of intravenous fluids. It can send your blood cell count down a bit.
Okay, so is this the reason you'd have a blood transfusion?
Yes, yeah.
Okay, so they said you're going to need a blood transfusion. So again, I'm kind of, again, like I say, lying there, not able to really communicate, just staring, and I still had to sign a blood transfusion waiver. I remember, like,
Oh wow.
I don't feel like I can really read or sign this, but I presume I did, because they gave me, I had 2 blood transfusions. Um, and yeah, so I think you're it's a very strange place to be in, because you forget, or maybe not forget, but your mind's in a very strange place where you're trying to come to terms with, they're explaining to you what's happening in your body, and you kind of know it's pretty serious. And so when I do remember one time my husband came to visit, and I just said, look after my boys for me. And I just thought, oh my god, like, I might not see them again. I hadn't seen them for days. I was in intensive care for 9 days. um but I can't really explain. I didn't miss them. I think I just was trying to make peace with not seeing them again, which sounds awful, sounds like I'm the worst mother, but you kind of feel like you have to distance yourself from your worldly life. And when you're in intensive care anyway, you could be on another planet. Like, you're just surrounded by beeping machines, and you're not even obviously eating or drinking or moving around. You're just being fed by machines. So you do feel not human anymore. And everyone's seen everything. Everyone's swabbed down everything. I've got, like I described earlier, on my horrible little vacuum bag of disgustingness coming out of my body. So you feel like almost like an alien that they're maybe keeping alive. And so you kind of start to distance yourself. And I think, that's a very strange place to be in, where you don't want to miss your life too much. You start to prepare for death, but then to survive is crazy. And so obviously, yeah, my husband was incredible. He ran to the local supermarket and got milk and bottles and figured out how you do all that stuff, because I'd been breastfeeding exclusively. And he told me after, like, his parents had come to stay in our house. So obviously I don't know what was happening. You can't FaceTime like you can normally when you're away from your family. And so yeah, they were just also amazing. I can't ever thank him and the family enough. And yeah, I guess it's really hard when you come out. And I think maternal sepsis adds another layer, because even when you come out of hospital, you're not just you now, you're still you with the baby to care for. And yeah, you mentioned bonding there, Ron. So I did talk about this a bit in my Sepsis Voices story on your website, but yeah, that was the worst bit, because he wasn't mine. Like, I got home, I hadn't seen him for days, 10, 11, 12 days, I can't remember. And he was wearing clothes I didn't recognize. It had been washed in like the wrong washing powder. I hadn't really smelt smells apart from like sterile smells, for a long time. And so everything smelt really odd and strong. That sounds a really weird thing to say, but I was so used to having no smells and everything being beige, to come home and suddenly it was noisy, and suddenly I was having to care for myself. And so it also feels quite scary. And I think particularly when it's sepsis, because I'd been in the hospital where I knew everyone was caring for me all the time. And then I remember coming home, I came home in a taxi, and like I'd had rehab to walk just over a couple of days before I came home. But even then, like, you sit down, you're like, oh my God, am I going to cut myself on the sofa? And like everything seems dangerous. And when you're first discharged, I was like, oh, like it's a bit scary. It was my house, but I hadn't known my house for so long, and your mind's been on such a journey, like your mind's exhausted, that going back to real life seemed really scary and really not like my life. Like, my life had been machines and people looking after me, and now I'm back in control. It's kind of like you've been put back in the driving seat and you're like, whoa, I wasn't ready to come back.
Wow, that's a really kind of eye-opening description, and that's probably common to huge numbers of people who survive serious illness or intensive care. This sort of, one thing I can share is that this strange sense of smell and taste, that's totally normal. And as you will have learned, it tends to gradually return to normal. But these strange symptoms, these after effects of serious illness, we don't tell people about, and we need to get a lot better at that. So coming on to your broader recovery journey, what support did you manage to access? What was offered to you, and what have you found in the 8 years since you were critically ill?
Well, the first kind of 7.5 years of that are quite easy, because I'm going to say none.
Wow.
And again, though, I think it's that added complexity of being a new mum and just feeling so grateful to be alive. Like, I got home and I was like, I'm back with my family, which, I didn't think was going to happen. And I was like, I just need to make this work for him, for my new baby son. I was like, I need to work harder. I need to be strong for him. So you don't have time to just sit and cry. You don't have time to sit and grieve what's happened to you, and because you just have to get on with it. And for any parents listening, like, you really don't have that much downtime, particularly when, like you mentioned earlier, attachment. I had to like work even harder with this attachment now, because he didn't know me and I didn't know him. So suddenly I feel like all those first few years since I recovered was just getting better and being stronger for him. And then it just so happens that, like you say, now I'm in academia, and the last few years I've been focusing on well-being and wellness and like mental health, having positive mental health. And I would say maybe the last 12 months, and obviously I've given people nuggets throughout the last 8 years. They love hearing the weird story of the nurse I thought that was poisoning me when she changed my fluids. I thought she was attaching cyanide. And they love, so at a dinner party I've thrown out nuggets of randomness, but honestly, you just feel so grateful to be alive, that well, for me personally, I didn't want to dwell on the fact that I could have died, and I didn't want to maybe not remember it, because I'll be honest, I'm always thinking about it every single day. my mind wanders back to the intensive care unit at least once a day. But you don't want to be that person that's always harping on about the bad thing that happened 8 years ago. So I say it's kind of the last 12 months, the more that I've been supporting others around me. I trained to be a Samaritan, and it just made me think, like, I really like to be there for people and listen to them, but how much have I spoken about my own journey? And so this was why when I saw UK Sepsis Trust, and all the stuff, I was really keen to share it and build other people's awareness. And then I'd say maybe the last 6 months, maybe I've thought, actually maybe I will feel better about everything if I talk more about it. And then the best thing I did, and it's really sad, this is 8 years later, is literally in the last couple of weeks, I went to one of your online recovery sessions, and it was the most therapeutic thing. I feel really emotional now, but the most
Wow.
therapeutic thing I've done in 8 years. Why on earth did it take me 8 years? Although I didn't see that opportunity 8 years ago, but oh my gosh, I have never felt, because I've told people bits of my journey, but I've never felt so secure to tell my story. And I cried like an absolute baby, but other people were crying like babies, and it just felt like, for anyone listening, or for anyone who's had something that you've never thought anyone could quite relate to, but suddenly I was in this online room. There were several people there, as well as the person from the UK Sepsis Trust to facilitate, but they had all had sepsis, all very different sepsis in all different parts of the body and places I didn't even know you could have it. And I've learned a lot even just in that session, but the unspoken safety of everyone having this shared experience. Everyone there had sepsis, so you just felt like you're amongst friends, even though I'd never met any of them before, all different ages, all different backgrounds. But it just felt like this safe space. And yeah, I told them like what happened to me very briefly, not as much as I told you today, Ron, and just like they got it. And I started telling them like some weird things and symptoms afterwards, and they were like, yeah, I had that. And just like the peer support from that, I think it was about an hour and a half, because I was teaching that day, so I only stayed an hour and a half. I think it went on longer, but oh my gosh, I left like I hadn't worn waterproof mascara, so that was an error. Anyone listening, if you wear makeup and you're going to one of these amazing groups, wear waterproof makeup. But I left the meeting and I just sat there, and it was just like a light bulb came on, and I was just like, wow, oh my gosh, I'm so glad I did this, and I hope I'll go to another one in the future. But even just that hour and a half online felt so good to finally know that I'm not alone in this journey.
That's incredible, Poppy. I mean, really good testimony to our support nurses and the brilliant work that they do. But if we can make one more person go to one of those support groups um, early in their recovery journey, then we will have achieved an enormous amount of good. And so, just for those listening, we have support nurses. We have not only online support groups, but we also have face-to-face support groups, which aren't as heavily accessed as they were prior to COVID-19, but they are still there. And we have a whole suite of written resources that we can offer people, as well as nurses on the end of a phone or an email. So support is there. It's probably our failing as much as yours, Poppy, that you didn't know about it, but certainly tell
No,
others
at all.
about it.
No, no guilt, no blame. But I'm not sure if I'm allowed to shout out, but the person who facilitated begins with O, and they're amazing. But yeah, just for anyone listening, please do it. For me, I didn't know any local ones in the area, so online was best for me. And I felt super nervous. I nearly cancelled 10 times because it said in the email, if you can't come, let us know. And I nearly did, because I was like, who wants to hear my story? Like, they don't even know me. But oh my gosh, like, I'm so glad. So for anyone listening, and I also thought I'm such a fraud because it's been 8 years. Like, I'm such a baby to be going now. But totally, there was just no judgment. The facilitator was like, no, just like, thank goodness you're here now. And everyone, what actually was really good, as someone who'd had it, such a long time ago, there were people there who've very recently recovered, some people that's been a year, 2 years, 3 years, 4 years. But actually, like, to be able to give a more long-term perspective on it, it's actually helpful that you'll all be at different stages as well. And so yeah, I would just say, for anyone listening, it's the best thing, the most productive thing I've done towards healing in the last 8 years since having sepsis.
That's incredible. Thank you so much. And so, finally, Poppy, you are vocal about sepsis on your social media channels, which obviously we massively appreciate because you have quite a significant reach on those channels. Obviously, you're primarily doing it to help others and to get the message out there. But what motivates you to do this? What do you get out of talking about maternal sepsis?
You know, I guess I just wish, there's that saying, I always mess up quotes, but something like, be the person you wish you'd had in your life when you were a child or something. I knew I'd mess it up. But I guess I just wish that if I had known about this sooner, um that I, maybe it would have been caught sooner, I wouldn't have ended up in intensive care, or even I think just showing that we've all got trauma, we've all been through really difficult things, because a lot of people on my network will, haven't had maternal sepsis, but can then, if we can all be kinder to each other and think, actually, we've all dealt with difficult things and tricky things, it just helps unite us, I think, and reminds us, that someone's there to listen, and we all struggle with things, but if we can all just help each other a little bit, it just makes the world a kinder place. So I just think, yeah, number one, raising awareness in the hope then one day someone will go, oh, could it be sepsis? Which is my number one. But yeah, I think just is so important that we, a lot of people say to me, you're really positive, but what I don't like is that toxic positivity, oh, everything's great, everything's sunshine, because I think it's about,
Yeah.
like, so many things in my life are sunshine, and for anyone who does follow me on socials, like, I have a very positive side because life is amazing and life's beautiful, and I think that's the best thing that sepsis taught me. In a way, it's like the kind of evil gift it gave me afterwards. It really, and for anyone listening who's had sepsis or, serious illness, you will know exactly what I'm talking about, because you thought it was the end and it wasn't the end. So every day I wake up is a blessing for me. Like, every day is incredible. So I do have that really annoying, very positive side. But I think also by showing that I went through this really awful, the worst thing that could happen to you, to be almost at end of life, to show that happened to me, but that you can still enjoy life and be happy. I just hope, I guess, to inspire others that you can still find joy. The horrible things might have happened to you, but with the right support around you, life is still worth living.
Wow, I mean, what an amazing philosophy. And, I totally agree. Goodness knows the world needs a lot more kindness in it at the moment. So,
Yeah.
so thank you. And Poppy, thank you so much for taking the time to share your experience. I really appreciate it. I know there's going to be other mums out there who've had sepsis who can relate to a lot of what you're saying. Um, and mums to be, or even people who are pregnant now, who will have learned, will know what to look for, and be empowered to act if they're getting a little bit
Oh,
worse with an infection. So for anyone listening who wants to know more about our support groups, more about maternal sepsis, you can get information at our website, which is sepsistrust.org. A reminder of those 6 key symptoms of sepsis, whether you're pregnant or recently pregnant or have never been pregnant, they spell the word sepsis. S for slurred speech or confusion. E for extreme pain in the muscles or joints. You ticked that one. P for passing no urine in a day, and you ticked that one. S for severe breathlessness. I for it feels like I'm going to die. Another big tick. And then the final S for skin that's mottled, discoloured, or very pale. Any one of those 6, whether you're pregnant or not, you go straight to A&E.
hmm.
Now, that's all we've got time for today. But please join us next time, where we'll be discussing how sepsis is represented in the media, a vital conversation about how awareness is the one key thing we need to do to save lives from this awful condition. Thanks so much for listening, everyone. Thanks to Poppy for sharing her story publicly for the first time ever. We're
Thank you.
incredibly grateful, and we'll see you soon.